I would say the first thing is people want easy access. Access has been a frustration point, of course. And I think that frustration comes for a variety of reasons. Some of it is just, the providers coming out of COVID and staffing shortages and those sorts of things. Some of it, of course, that we've seen boil as it relates to frustration around utilization management. And I'm sure there are other drivers as well. But they want easy access. And that's, being able to get into the provider. It's the insurance company making it easy for them to access the provider that they want and to have multiple avenues for access, I think, as well. COVID was a blessing in that regard that we finally figured out, as a nation for sure, that we could do lots of things virtually, and virtual care was okay for lots of different services. And we've definitely taken a step back in that regard since, the way we were all utilizing and accessing healthcare in the darkest days of COVID. But we still are way better off than we were before COVID in that regard. And so I think consumers are used to that. That was one of the drivers, frankly, of us putting our enhanced mental well-being program in place, because it does enable in-person service, but it has a very easy platform for virtual access of mental health services. And as that was the area that saw the most uptake through COVID. And there's a whole bunch in that arena that is, less acute and could be cared for virtually to preserve the physical access for the most acute population that really requires that in-person visit. And we've seen, great uptake on that, and have been able to offer services generally in less than 2 days, between the time the person first says, hey, I want to be seen, and their actual appointment time, which is unheard of versus, what it was without that sort of solution. So access is the first thing that comes to mind for me in terms of consumer trends.